Hi, I'm Missy from the Birth Center at Salina Regional. There's just a few things we would like to let you know about. So when it's time for you to come see us, there's one of two places you need to go. If you're here for a scheduled induction or C-section, we would like you to go to main registration in the main lobby to get registered, and then we'll come get you. If you are here in labor or for any other concerns, please go to the emergency department, and then we will come pick you up and bring you to the 6th floor. When your visitor comes to see you or comes back from lunch in the cafeteria, they'll come up to the 6th floor and pick up this phone. We are a locked unit, so only direct family members are allowed in, and they'll pick up this phone and it will ring to our desk person, and you'll let them know who you are and who you're here to see, and they will page you in. Hi Kathy, can you let us in? Thank you. Let's go see the rest of the birth center. Hi, I'm Felicia, one of the nurses on the birth center at Salina Regional.
And my name's Cassidy. I'm also a nurse up here on the birth center.
Today I'm going to walk you through one of our labor rooms. So when you first get to the hospital, and we'll have you come into your room and we'll have you change into one of our hospital gowns, and you'll go into your nice big private bathroom for you. Once you get changed, then we'll have you go ahead and lay in one of our labor beds. The first thing we'll do is hook you up to our fetal monitoring system. This is called a TOCO, and what this does, this monitors your contractions throughout your labor. And the other one is an ultrasound, and this is going to monitor your baby's heart rate during your labor process. We have centralized monitoring systems, so we're able to watch your baby and you on this system, and then up here, and the doctors also can access it at their office, and then out at our nurses station we can also see your fetal heart strip too. We'll also hook you up to a blood pressure cuff. It'll take your blood pressure every 15 minutes during labor. You'll also put on a pulse ox, and we have you wear that so we can tell the difference between your heart rate and your baby's. Once we get you settled into bed, then the next process will be starting your IV. That doesn't take very long to do. Once we get your IV placed, the next thing we'll do is we'll go over a few consents with you. Once the consents are done signing, we'll ask you your medical history along with your OB history. So a few things there. Once that's done, then we will start your labor, and we have several different birthing balls. Those are offered for pain management along with comfort measures during your labor with us.
During your day, we also like to keep you up to date, so we have this chart here that we fill out. It has your doctor's information, your baby's information, what you can eat, what your plans are for the baby, what your pain control is, and then kind of progress through labor. So that's nice to be able to see through the day. Over here is the baby warmer, so we like you to be able to have your bonding time and skin to skin with baby. But after that's all done, we bring baby over here to this warmer. We get our vital signs, footprints, we do newborn shots and all of that over here. If for some reason baby needs to come over here sooner after delivery, we have our oxygen and suction all set up here too.
Hi, I'm Tiffany, and this is our tub room. It can be used during the beginning stages of labor. We unfortunately do not allow for our patients to deliver in the tub just for safety.
Hi, I'm Hannah with Salina Regional Health Center Birth Center, and I'm going to tell you a little bit about getting ready for a C-section. You will come in a couple hours before your C-section is scheduled, and we'll bring you into one of these delivery rooms. At this point, we'll get an IV started, we'll go over some consent forms, we'll get you hooked up to the monitors, and we'll kind of go over the plan for the whole day. After your anesthesiologist and your physician come in and visit with you, we will then walk you back to our OR. Okay, so the good thing about our birth center is our operating room, or our OR, is located on the same floor as all of our delivery rooms. So after you've been in the delivery room, if you're going to have a C-section, then we'll just walk back to the OR. Once you come into the operating room, you will sit here on the bed. Your anesthesiologist is going to make sure you're comfortable, either with an epidural or your spinal, and then you'll be laid back. Your anesthesiologist will always be up here at the head of the bed with you, along with your support person here on this stool also. The nurse will continue to check on you during the whole C-section also to make sure you're doing okay. Once the baby is out, then the baby will be taken over to the warmer over here, dried and stimulated, make sure baby's doing okay, and then baby can be brought over to you to do some skin to skin while the doctors are finishing up with the C-section. Once they're all finished up, you, baby, and your support person will then be taken over into our recovery room. And you'll be here in the recovery room for about an hour. During this time, we'll be checking your vitals and then also doing baby admission stuff. So baby's meds, measurements, and then working on bonding and breastfeeding or bottle feeding, whatever you choose. And then after this hour is over in here, then you'll go over into the postpartum room.
Hello and welcome. I'm Sanya. This is our 8-bed level 2 nursery where we take care of babies who may need a little extra help with feedings, such as NG feedings, IV antibiotics, IV therapy, IV fluids. They may need supplemental oxygen, phototherapy, those kind of things. They stay here. We keep babies that are 34 weeks plus gestation. They stay here in the NICU until they're ready to be either discharged home or just room out with their parents.
Hello, I'm Tessa. I'm a nurse on the birth center at Salina Regional Health Center, and this is one of our queen bed postpartum rooms. This is a room that you'll be staying in for most of your stay after you have your baby. Once you and baby are stable, you'll move to one of these rooms about 2 or 3 hours after delivery. It's just a nice spacious room for you and your support person to get used to taking care of baby. So our babies room in with parents 24 hours a day. The only time babies should need to leave the bedside are for a procedure and circumcisions or different things like that. We also can do a bath at the bedside. We have this fancy new turtle tub system, which is nice because the baby stays warm and wrapped in a blanket. They don't lose as much heat and their blood sugars remain stable, so we can do this as early as 8 hours of life. And it's nice to do that at the bedside because mom and dad can help with that. We'll also, at discharge time, be sure to go over all of your education plan to make sure you feel good taking care of yourself and your baby before you go home. And this is a surgical bed. We have these available for our moms who've had a cesarean delivery or a hysterectomy or some other reason that they need a medical bed that raises and lowers and is easier to get in and out of. So this bed doesn't have as much room for your support person, so we do have cots available we can bring in for your support person to stay the night. Most people who stay in these rooms are here for 2 to 3 days before they're ready to discharge home. Before you leave, we make sure that we get your discharge education completed with all of the information you need for mom and baby, so you feel good taking care of yourselves before you head home.
Hi, I'm Nancy. I'm the lactation consultant, IBCLC, at Salina Regional Health Center. This is our lactation room that we follow up with moms on an outpatient basis to see how feedings are going. If you have questions, comments, concerns, I help with showing you how to latch. We do a weight on the baby with a scale in here. I also follow up with moms that are after delivery if they need help with breastfeeding to make the breastfeeding journey a little easier at the beginning.
And finally, thank you for enjoying our video. I'm Stephanie, the clinical coordinator on the birth center. If you have any questions, don't hesitate to ask or call 785-452-6555.